Having an operation is a big deal. It's a significant event in anyone's life, and it's natural to feel a mix of emotions from anxiety to anticipation. It can be a bit scary, but getting ready the right way makes it safer. Proper preparation can help ease your mind and ensure everything goes smoothly. It all starts with you. Before your operation, you'll chat with your surgeon. This conversation is crucial as it sets the stage for your surgery. You'll talk about your health. You'll talk about what's going to happen and any risks. This is the time to ask any questions you might have and to understand the procedure fully. You might have some tests, like blood tests or scans. These tests help the medical team get a clear picture of your health and plan the surgery accordingly. The surgeon will explain about anesthesia. Anesthesia is a critical part of the surgery process, and understanding it can help alleviate some of your concerns. Anesthesia helps you sleep during the operation so you don't feel any pain. It's administered by a specialist who ensures you're comfortable and safe. A special doctor called an anesthesiologist will be there the whole time. They monitor your vital signs and adjust the anesthesia as needed. On the day of your operation, you'll go to the hospital. It's important to arrive on time and follow any pre-surgery instructions given to you. You'll change into a hospital gown. Nurses will check your heart rate and breathing. These checks ensure that your body is ready for the surgery. They'll make sure you're ready. The medical team will be there to support you every step of the way, ensuring you feel as comfortable and prepared as possible. Finally, you'll be wheeled into the operating room. The surgical team will be ready and waiting, having prepared everything for your procedure. During the surgery, the team will work with precision and care. Each member has a specific role to play, ensuring the operation goes as planned. After the surgery, you'll be taken to a recovery room. Nurses will monitor you closely as you wake up from the anesthesia. Your family can visit you once you're settled. The doctor will discuss your recovery plan and any next steps to ensure a smooth healing process. Following the doctor's instructions at home is crucial for a successful recovery. Rest, take your medications, and attend follow-up appointments as advised. Remember, the medical team is there to help you. Don't hesitate to reach out if you have any concerns or questions during your recovery. Your health and well-being are their top priorities. Filling out medical forms accurately is essential. These forms provide the medical team with vital information about your health history, allergies, and current medications. Following pre-surgery instructions such as dietary restrictions is crucial. These guidelines help reduce the risk of complications during surgery. Preparing your home for post-surgery recovery is also important. Make sure you have a comfortable space to rest and all necessary supplies within reach. Arrange for a support system. Having someone to help you with transportation and post-surgery care can make a significant difference in your recovery process. Each member of the surgical team has a specific role. The surgeon leads the procedure, while the surgical assistants and nurses support by preparing instruments and maintaining a sterile environment. The anesthesiologist ensures you remain unconscious and pain-free, while the surgical nurse assists the surgeon by handing over instruments and keeping the area clean. Following a pre-surgery checklist is vital. This checklist includes steps like fasting, avoiding certain medications, and arranging for post-surgery care, all of which contribute to a successful surgery. Meeting with a physical therapist before surgery can also be beneficial. They can guide you on exercises and movements that will aid in your recovery post-surgery. Organizing your medications and setting up a recovery area at home ensures you have everything you need within reach, making your recovery smoother and more comfortable. Discussing your surgery and recovery plan with your family is important. Having their support and understanding can make a significant difference in your overall experience and recovery. The operating room is a busy place. It takes a whole team to do an operation safely. Everyone has an important job. The surgeon is in charge. They have studied for years to learn how to do operations. They make decisions during surgery. The anesthesiologist keeps you asleep and checks your breathing and heart rate. They give you medicine so you don't feel pain. Nurses are super important too. They get the instruments ready. They help the surgeon during the operation. They keep a close watch on you. Surgeons use special tools. These tools are made for specific jobs. They are made of strong, clean materials. Scalpels are like very sharp knives. Surgeons use them to make cuts. The size of the scalpel depends on the operation. Forceps are like tweezers. They help surgeons hold tissue. They come in different shapes and sizes. Clamps are used to stop bleeding. They close off blood vessels. This lets surgeons see clearly while they work. Every operation has a plan, but sometimes unexpected things happen. Surgeons need to be ready for anything. Bleeding can happen. Surgeons use clamps and other ways to stop it. They can give you more blood if needed. Infection is a risk with any operation. The surgical team follows strict rules to keep everything clean. Antibiotics help stop and treat infections. Surgeons train for years. They learn how to handle emergencies. They have backup plans just in case. Section 5. The price of health, understanding surgical costs. Operations can be expensive. The cost of surgery can be a significant financial burden for many individuals and families. It's important to understand what contributes to these costs and how they can vary. The cost depends on lots of things. Factors such as the complexity of the procedure, the surgeon's experience, and the technology used can all influence the final bill. Additionally, preoperative and postoperative care are also part of the total cost. These include the type of operation, the hospital, and where you live. For example, a heart surgery in a major metropolitan hospital may cost significantly more than a similar procedure in a smaller rural hospital. Geographic location plays a crucial role in determining healthcare costs. In the United States, healthcare costs a lot. The U.S. healthcare system is known for its high expenses, often leading to financial strain for patients. Even with insurance, out-of-pocket costs can be substantial. Insurance companies try to get lower prices from hospitals. They negotiate rates to make healthcare more affordable for their policyholders. However, these negotiations don't always result in lower costs for patients. But patients often have to pay a lot themselves. High deductibles, co-pays, and uncovered services can add up quickly, leaving patients with significant medical debt. Other countries have different systems. Many nations have implemented universal healthcare systems that aim to provide medical services to all citizens at little or no cost. Some have free healthcare for everyone. Countries like the United Kingdom and Canada offer healthcare funded by taxes, ensuring that all residents have access to necessary medical treatments without direct charges. This means everyone can get care without paying a lot. These systems aim to reduce the financial barriers to healthcare, promoting better health outcomes for the population. The cost of surgery includes more than just the operation itself. It's important to consider all the components that make up the total expense. It also includes anesthesia, staying in the hospital, and medicine. Post-operative care, rehabilitation, and follow-up visits are also part of the overall cost, making surgery a complex and often expensive endeavor. Section 6. The road to recovery, after the operation. This is a crucial phase where your body begins the healing process. Understanding what to expect can help you manage your recovery better. Getting better after surgery takes time. It's important to be patient with yourself and allow your body the time it needs to heal properly. Rest is essential during this period. Your body needs to heal. This involves the repair of tissues and the reduction of inflammation. You might notice swelling and bruising around the surgical site, which is a normal part of the healing process. How long it takes depends on the type of operation you had. Some surgeries require a longer recovery period than others. Your doctor will provide specific guidelines based on your procedure. After surgery, you'll wake up in a special room called the recovery room. Here, medical staff will monitor your vital signs to ensure that you are stable and comfortable. Nurses will watch you carefully. They will check your blood pressure, heart rate, and oxygen levels regularly. This close monitoring helps to catch any potential complications early. They'll give you medicine for pain. Managing pain effectively is crucial for your comfort and recovery. Don't hesitate to let the medical staff know if you are experiencing discomfort. You might need to stay in the hospital for a few days. This allows the healthcare team to provide you with the necessary care and support during the initial stages of your recovery. This gives your body time to heal. The hospital environment is designed to support your recovery with access to medical equipment and professional care. It also lets doctors check on you. Regular checkups by your doctor ensure that your recovery is on track and that any issues are addressed promptly. When you go home, you'll need to rest. Home recovery is a continuation of the healing process. Make sure to follow your doctor's instructions carefully. You might not be able to do everything you normally do. Activities that require physical exertion should be avoided until you get the green light from your doctor. You'll need to take care of your wound. Proper wound care is essential to prevent infection and promote healing. Follow the instructions given by your healthcare provider for cleaning and dressing the wound. Gradually, you can start doing light activities as recommended by your doctor. Gentle movements and exercises can help improve circulation and speed up the healing process. Follow-up appointments are crucial. These visits allow your doctor to monitor your progress and make any necessary adjustments to your recovery plan. With time and proper care, you'll start to feel better. Remember, recovery is a journey, and every step you take brings you closer to full health. Section 7. A glimpse into the past. Surgery through the ages. Surgery has been around for a long time. Even ancient civilizations did simple operations. Over time, surgery has changed a lot. In ancient Egypt, priests did operations. They used tools made of bronze and obsidian. They fixed wounds and broken bones. Discovering anesthesia in the 1800s changed everything. It meant surgeons could operate without causing pain. Today, surgery is very advanced. Surgeons use lasers, robots, and tiny instruments. These new tools make surgery safer and better. Section 8. Saluting the surgeons. Dedication and skill. Surgeons are very skilled. They spend their lives helping others. Their work needs careful hands, lots of knowledge, and kindness. Becoming a surgeon takes years of training. After medical school, future surgeons do special training. They learn from expert surgeons. Surgeons have to keep learning about the newest techniques. They go to meetings and read research. They never stop learning. A surgeon's job is tough. They often work long hours, they deal with stressful situations, but they always care about their patients. Section 9. The enduring miracle of surgery. Surgery is amazing. It lets us fix injuries and cure diseases. It makes people better and saves lives every day. From simple procedures to complicated operations, surgery keeps getting better. There are always new technologies and techniques. Even though it's complicated, surgery is about helping people. It's about making people healthy and giving them hope. The next time you see a surgeon, remember how skilled and caring they are. They are true heroes.